Hello. As we continue to experience growth throughout the entire organization, I want to thank all of our physicians, advanced practice professionals, and staff for all you do to care for our patients. Our Shannon mission has always been focused on providing exceptional care and meeting the needs of our patients in the Concho Valley. As Shannon continues to grow, our goal is to maintain first-rate facilities, technology, and physicians for our patients. In 2060, it's estimated that the population of those over 65 will actually double. I know this sounds like many years away, but it's important that we begin planning today to ensure that we can provide care for the growing number of patients. To create additional access for our patients, we need to recruit more primary and specialty care physicians. We also need to ensure that we are bringing needed services here to patients so they don't have to travel for care. Additional hospital capacity will also be required as inpatient needs grow. We learned so much through the COVID-19 pandemic over the last year, including that we needed more ICU and adult care beds to ensure that we meet the needs of our patients in the future. Meeting all these needs requires expanded space in our facilities. We have created a plan for several construction projects. Some are currently underway and some are planned to be completed over the next 5 years. Along with creating additional access, these projects are focused on enhancing convenience for our patients so that they can have the best possible care and experience at Shannon. We are so fortunate to have the local support of the Shannon Trust. Their commitment to providing the best facilities for our patients ensures that we have the capacity to serve our community as we continue to grow in the future. Shannon was founded to care for all citizens of the Concho Valley. The hospital is responsible for producing revenue to cover its operations, including salaries and supplies, and also funding charity care. The Shannon Trust is there to support access to care, technology, and maintaining facilities. Most hospitals can't do projects like this in our current healthcare environment, and we are very grateful and blessed to have the Trust for funding the necessary expansions. Today, I'd like to share more about each of these projects. When we looked at the South Campus, they had an MRI that was actually over 20 years old. And we just replaced that just recently in November with a 1.5T, which is exciting because this is additional and enhanced MRI that we didn't have here in San Angelo until this November. Also, we're going to add a 3T MRI downtown. Now, we have to build out some construction to make this possible, so it's going to take us a few months. So it's going to take us about 6 or 7 months to do this. We're hoping to have this project completed by July of 2022. As we looked at the South Campus, our skilled nursing facilities on that campus, as you might recall, during the winter storm, we had to move our skilled nursing facility out to the South Campus from St. John's. We're going to move the skilled nursing facility back to St. John's so that we can remodel that area on the South Campus and then move skilled nursing facility back permanently, and they'll have a really nice and beautiful space there on the South Campus. We just received state approval, so we're going to be moving forward on moving them back to St. John's pretty quickly. We're also excited about our partnership with West Texas Rehab. We're partnering with them to have an inpatient hospice unit on the South Campus, roughly about 15 beds. We're looking to have this go forward starting in July 1st, 2022. We are super excited about this downtown project, which involves the oncology center, and really involves more than just the oncology center, but also a 5-story parking garage, as well as rebuilding our retail pharmacy and adding some more office space. Again, one of the reasons why we're having to do some of this construction is because of the growth that we're seeing in the oncology side. We're super excited about this. We have 2 fantastic oncologists today. We have a future one coming soon, Dr. Hall. We have room to actually expand if we look to recruit additional oncologists. For every 300 square feet you build in terms of square footage, you have to have a parking spot. And so we're at a point that we can't, there's not enough pavement anymore, so we're building a parking garage, and it's a 5-story parking garage, and it's behind the oncology center and kind of behind that retail pharmacy office building. We're also super excited about the retail pharmacy. As you might recall, we're actually building this in the same location that our retail pharmacy building was, and then also our office a little office building where marketing and general counsel was located. We're going to have to knock down both those buildings. That's why we're going to rebuild the retail pharmacy. It's going to have multiple bays. And then on top of the retail pharmacies, when we're going to add office space, which will soon be the home for marketing, human resources, and general counsel. And when you think about the projects in terms of their completion dates, the parking garage will be finished in July 2022, the pharmacy in August of 2022, and then the oncology center and the office space in December 2022. Today, we have wound care and hyperbarics at 2 locations, the South Campus as well as St. John's. We want to take both those locations and consolidate them downtown. We're going to plan this process over the next year, but once the oncology center is completed and the oncology services moves and regional cancer treatment center moves from the Magdalene facility, that's when we'll consolidate wound care and hyperbarics downtown in the Magdalene facility. We're also super excited about when we're able to move oncology to its new location. There's going to be expanded room for the cardiac rehab department to expand. So we'll be also looking to do that post December 2022. We're also looking to expand our women's and children's footprint downtown. We're really excited about this. This is something that several people have been working on for a long time. I had to give credit to Dr. Meyer and Dr. Dunham, as well as Dr. Wayner, as well as Pam Bradshaw and Dale Droll. They've been working on this for some time, but what we're looking to do is to expand our women's and children's footprint and consolidate these services downtown. So this expansion will include 1 observation unit, 2 additional operating rooms, 4 additional labor delivery rooms, and up to 10 patient rooms. So we're excited about this project. We'll be finished with this project because we got an early start on it by July 2023. One of the things that we learned through the COVID-19 pandemic is that we needed more ICU and adult beds. So we're looking to expand downtown. So what we're going to do is the ICU department is on the 3rd floor. So we're going to build a parking garage up to the 3rd floor, come across with expanding ICU. That will give us an additional 20 ICU beds, so pretty much double our ICU capacity. And then on top of that, we're going to add another floor, the 4th floor, for 28 med-surg beds, adult acute beds. And then we're looking to shell out the 5th and 6th floor for future growth. We're hoping to have this project completed by January of 2024. Another project that we're working on is our east expansion. We do have a need to expand our ED and also expand our surgical services, so we're looking to do that on the east side of the building. We're also looking to add a 4th cath lab. And I apologize, we don't have a rendering yet, so more to come on this, but our estimated timeline on this is March of 2024. We're also looking down the road is what do we do with the Behavioral Health Center on our St. John's campus. St. John's is one of our older campuses for Shannon, and we're looking to move a lot of those services from that location to different areas of the city. Behavioral health is on the St. John's campus, so we're going to be looking at different locations. We're thinking about the South Campus now, and we'll start the planning process looking around 2023, 2024, and estimated to start building somewhere in that 2024-2026 timeline. We are so excited about each of these projects and the additional benefit they will bring to our patients and their families, along with our physicians, advanced practice professionals, and staff. As each project moves forward through its milestones, we will be sharing more information and details with you. I look forward to our continued growth and expanding the future of healthcare in Concho Valley.